Monica, Kim, can you hear me?
Yes, I can hear you.
Great. Okay, so this is from Monica.
Okay, thank you.
You're welcome.
We can go ahead and get started.
All right. Good afternoon, Dr. Ferrer. And good afternoon, everyone. Thank you so much for joining us today, February 3rd, for a media briefing. Today, we have the Director of Public Health, Dr. Barbara Ferrer, presenting. Once she finishes, we will take your questions. Please remember you can chat me, the host, to get in queue for a question, or you can raise your hand using the hand icon. Dr. Ferrer, when you're ready.
Thank you so much. Good afternoon, and thanks for joining us. I appreciate the opportunity to once again provide you with our latest update on the COVID-19 pandemic. In today's briefing, I'll share our current metrics on cases, hospitalizations, deaths, and variants, our latest vaccination coverage data, school data, including information on testing, outbreaks, and school-based vaccination clinics, information regarding business compliance with our revised masking requirement, and information regarding our planned approach to preventing and managing COVID-19 as our winter surge subsides. We'll go to slide 1. I'll start with the customary update on current COVID-19 metrics. Last week, I announced that after weeks of steep increases, the number of daily reported COVID-19 cases, our test positivity rate, and hospitalizations were all declining. Today, I'm pleased to share that although we still have a ways to go to return to pre-surge levels, we continue to see real declines in each of the metrics this week. Today, we're reporting 11,548 new cases, which is about a quarter of the number that we reported several weeks ago when we hit our record high of nearly 46,000 cases in a single day. The average number of daily new cases reported over the last 7 days is down to approximately 15,600, and that's from about 28,000 for the previous 7 days. The average daily case rate over the past 7 days is now 154 cases per 100,000 residents. CDC calculates somewhat differently a weekly case rate, and it shows LA County at over 1,500 cases per 100,000 residents. That's a weekly case rate, which continues to keep LA County as an area of high transmission. In addition, our daily average test positivity rate declined to about 8% today, and that was at about 11%, I think, last week. The number of people needing to be hospitalized due to COVID-19 has also substantially declined. For the first time in several weeks, our daily hospitalizations have dropped to below 3,500. As you can see, we're reporting about 3,398 new hospitalizations today. Average daily hospitalizations for the past 7 days is at about 3,800 hospitalizations. By comparison, just last Thursday, our 7-day average for daily hospitalizations was 4,600. And this is encouraging news, but sadly, as you can see here, we're not seeing a corresponding decline in reported deaths. And each day, we're still losing dozens of people across the county to COVID-19. Over the past week, there was an average of about 70 deaths reported each day. I do send my heartfelt condolences and wishes for healing to all who have lost a loved one to COVID. Next slide. This slide is a visual of cases, hospitalizations, and deaths from last July 1st through today. Here you can see the steep increases in cases and hospitalizations that occurred during our winter surge, followed by a steady decline over the past couple of weeks. While this recent downturn is very encouraging, both cases and hospitalizations remain pretty high, especially when compared to the low numbers that we saw for much of last year. Furthermore, deaths, which is the blue line at the bottom, continue to trend slightly upward. Because deaths lag cases and hospitalizations, I do remain hopeful that we'll start to see fewer people dying from COVID-19 in the upcoming weeks. However, if we want to bring our cases, hospitalizations, and deaths closer to pre-surge levels, we're going to need to continue common sense protection measures that we know can slow COVID-19 transmission. These include wearing a mask when around others until transmission is lower, testing if possible when gathering with others, especially if you're gathering with those of high risk, or you were exposed to a positive case, or you're gathering indoors in crowded places where masks are not always worn. As always, please stay home and away from others if you're sick, and get vaccinated and boosted if you're not already up to date. Next slide. Since the start of the pandemic, we've been closely monitoring and reporting out on COVID-19 related deaths. I've shared our daily counts, and we'll share our updated analysis of death rates by vaccination status today as well. I do want to take a step back and report the cumulative number of COVID-19 related deaths we've had in LA County since the start of the pandemic. These data are derived from death certificate data and include deaths from the cities of Long Beach and Pasadena for the period of March 1st, 2020 through December 31st of 2021. For comparability with data regarding other causes of death, the COVID-19 counts I'm reporting on for this slide are based just on our death certificate data. The daily and cumulative COVID-19 death counts that we typically report take into account death certificate information as well as information from other data sources. This includes deaths that are reported by facilities and the coroner, as well as from our interview and outbreak reports. Based on death certificate data between March 1st, 2020 and December 31st, 2021, COVID-19 was the leading cause of death in LA County, with 24,947 deaths due to COVID-19. Prior to the pandemic, the leading cause of death in LA County was coronary heart disease. And while the number of deaths from coronary heart disease remains very high, over these 22 months, coronary heart disease deaths accounted for 21,513 deaths. So smaller number than that as from people dying from COVID. Many have noted that COVID is like influenza. However, as you can see, over the same 22 months, there were far fewer deaths from respiratory illnesses. 3,422 pneumonia and influenza deaths were recorded on death certificates. Of note, the measures that we implemented to prevent the spread of COVID-19 also likely led to significantly lower transmission of other respiratory illnesses during this reporting time frame. And while vaccines and therapeutics offer powerful protection against death, even our recent numbers continue to highlight how, in comparison to other respiratory illnesses, COVID remains more deadly. For the month of December, we observed 396 deaths from COVID and 163 deaths from pneumonia or influenza, and this is, again, looking at the death certificate data. Clearly, despite the availability of vaccines and the dominance of Omicron, which generally causes less severe disease than prior variants, COVID-19 deaths continue to far outstrip deaths due to other respiratory illnesses. At a national level, a New York Times analysis published yesterday revealed that the U.S. now has a far higher COVID-19 death rate than other large high-income countries. Their analysis revealed that Americans are now dying from COVID-19 at almost double the daily rate of Britons and 4 times the rate of Germans. The authors identified several factors that have likely contributed to this, and suggested that lower vaccination and booster rates in the United States may be the chief reason. Together, these local and national findings are important reminders that COVID has led to inconceivable illness and death, and increasing vaccination and booster rates offers the best hope for reducing the most tragic outcome from COVID infection. Next slide. As we optimistically watch our declining cases and hospitalizations, we're also keeping a close eye on the BA.2 Omicron subvariant, which has been found in Los Angeles County. Scientists are closely studying BA.2 to determine whether, compared to BA.1, the more common Omicron strain currently circulating, it may spread more easily from person to person, lead to more severe illness, or be resistant to treatments or vaccines. Some preliminary findings have been released, but as is the case with other emerging variants, these may be revised as the science develops. But very early findings suggest the following. COVID-19 vaccines may offer similar levels of protection against symptomatic disease caused by BA.1 and BA.2. An initial analysis by the UK Health Security Agency has estimated that vaccine effectiveness against symptomatic disease 2 weeks after receipt of a booster dose was 63% for BA.1 and 70% for BA.2. BA.2 appears to be slightly more transmissible than BA.1. However, further studies would be needed to understand the infectiousness of BA.2 and to determine whether it spreads more easily than BA.1. Not much is known yet about severity of illness caused by BA.2. However, some very early findings have suggested that BA.2 is not acting differently or leading to more severe illness at a population level than BA.1. While scientists work to further understand any potential differences between BA.1 and BA.2, public health continues to monitor our sequenced results. Please note that there are always delays in sequencing affecting the totals for the most recent weeks. But in this slide, you can see the latest data on sequenced variants here in LA County. The red bar represents Omicron, the dominant variant in LA County, and the blue bar represents the Delta variant. The yellow bar, which is barely visible, represents other variants. As you can see, 99.9% of specimens sequenced for this latest reporting period were Omicron, the variant that drove our winter surge. We are monitoring the spread of BA.2 Omicron subvariant and to date have identified 17 BA.2 variant cases in LA County. Next slide. As usual, I'm also sharing our updated trend lines of cases, hospitalizations, ICU admissions, and deaths, broken down by vaccination status. The data continue to show that when compared to unvaccinated individuals, people who are fully vaccinated are less likely to be infected with COVID-19, be hospitalized with COVID-19, require care in an intensive care unit, and die from COVID-19. Furthermore, they suggest that while being fully vaccinated provides strong protection, the people who are best protected from COVID-19 infection and severe illness are those who were fully vaccinated and had their booster dose. We're looking first at cases here by vaccination status. This slide shows COVID-19 cases for 3 groups. Unvaccinated individuals, that's represented by the dotted lines. Individuals who are fully vaccinated but didn't receive their booster dose, that's by the dashed lines. And individuals who were fully vaccinated plus had their booster dose, and that's the solid line at the bottom. You can see the recent decline in COVID-19 cases across all 3 groups. For the week ending January 22nd, individuals who were fully vaccinated but had not received boosters were about 2 times less likely to be infected with COVID-19 than unvaccinated individuals. Those who were fully vaccinated and had a booster dose were even more protected and were about 4 times less likely to contract COVID-19 than unvaccinated individuals. We can go to the next slide. This slide shows the age distribution of our January 2022 cases compared to the age distribution of the overall LA County population. The highest percentage of cases were reported in the 30 to 49 age group, followed by the 18 to 29 age group, which together accounted for nearly half of the cases reported in January. While children accounted for fewer cases than these groups of adults, children 5 to 11 and 12 to 17 years of age represented a larger share of cases relative to their share of total population. For instance, 12 to 17-year-olds represented 13% of January cases, but only 7% of the LA County population. And 5 to 11-year-olds represented 15% of January cases, although they comprised just 9% of the LA County population. Higher rates of testing in this school-aged population may have contributed to the higher share of cases in the 5 to 17-year-old age groups. Regardless, this data shows that children do get infected with COVID-19. In January 2022 alone, there were nearly 100,000 cases among children 0 through 17 reported to public health, and about 234,000 cases among children 5 to 17. Some of these children became ill with COVID-19, all needed to miss school and school activities, and given the high transmissibility of Omicron, some went on to infect vulnerable individuals at home, school, childcare centers, and in community settings. Thus, it's important that while transmission remains high, we continue the common sense safety measures to reduce transmission among children, including masking, testing, and improving vaccination coverage levels. Next slide. Like with cases on this slide, you can see a steep increase in COVID-related hospitalizations a few weeks ago, followed by a promising recent dip. When reviewing our latest hospitalization data, we see even more striking differences in the outcomes between vaccinated and unvaccinated individuals. This slide shows COVID-19 hospitalizations by vaccination status. For the week ending January 22nd, 2022, residents that were fully vaccinated but hadn't received a booster dose were about 6 times less likely to be hospitalized with COVID-19 than those who were not vaccinated. Those who were fully vaccinated and had received booster dose had even higher levels of protection and were about 22 times less likely to be hospitalized than unvaccinated individuals. Next slide. During the winter surge, as COVID-19 hospitalizations have risen, we've also seen an increase in the number of COVID-19 patients requiring care in an intensive care unit. In the past, we weren't able to calculate stable rates separated by booster status because there were just too few patients who were vaccinated and boosted in the ICU. However, as of January 3rd, we have sufficient numbers to include this group, which you can see in that short solid line at the very bottom. These data show that unvaccinated individuals were most likely to require ICU care, and that those COVID-19 patients who were fully vaccinated with a booster were least likely to be admitted to the ICU. For the period ending January 22nd, residents who were fully vaccinated and had a booster dose were about 31 times less likely to need care in an ICU than those who were not vaccinated. Next slide. When reviewing our death rates by vaccination status, we couldn't calculate stable rates for vaccinated individuals separated by booster status because there are just way too few deaths of people who are vaccinated and boosted. So we're only able to compare deaths between all fully vaccinated people, boosted and not boosted, and unvaccinated people on this slide. As is the case for infections and hospitalizations, when looking at deaths, we found that unvaccinated individuals had worse outcomes than vaccinated individuals. For the period ending January 15, individuals who were fully vaccinated were about 12 times less likely to die from COVID than those who were unvaccinated. When we consider these data on deaths in concert with the case, hospitalization, and ICU data, it remains clear that vaccines continue to provide significant protection against COVID-19, especially against severe illness and death. Our data also show that booster doses add an important extra layer of protection against disease and severe illness. Next slide. Given the effectiveness of vaccines, we're relieved to see incremental increases in vaccine coverage levels. For instance, between January 2nd and January 30th, the percent of residents 5 years of age and older who received at least one dose of COVID-19 vaccine increased from 79% to 82%. And the percent of people in this age range who were fully vaccinated increased from 71% to 73%. This is good progress for a month's time, But to better protect against COVID-19, we're going to need to, one, increase rates among all the younger age groups, particularly for 5 to 11-year-olds, where only 32% have received at least one dose of the vaccine. And two, we need to protect more people with booster doses. Everyone 12 years of age and older without a contraindication is eligible for a booster. But as of January 30th, only 37% of those eligible have received their additional or booster dose. Next slide. This means that there's nearly 2.7 million residents, 12 years of age and older, that didn't receive an additional booster dose within their eligible period, and 1.8 million residents, ages 5 years of age and older, who are eligible for and haven't received their first COVID-19 dose. If you go ahead and look at this table here, you can see the number of first, second, and booster doses administered over time. The pace has recently slowed, with about 185,000 first, second, and booster doses administered between January 24th and January 30th. That's versus about 380,000 vaccine doses that were administered between December 6th and the 12th. Until these numbers increase, there will be continued need for us to acknowledge that we have vaccine preventable illness and deaths occurring from COVID. And I do want to note that vaccines are readily accessible at public health centers, doctors' offices, clinics, pharmacies, schools, outreach sites, community sites. There's over 600 mobile teams that are out this week all across the county. We ask residents who are ready to get a vaccine or need to get a second dose or get boosted to please visit vaccinatelacounty.com or vacunatelosangeles.com or call the DPH Vaccine Call Center at 833-540-0473 between 8 a.m. and 8:30 p.m. 7 days a week. You can get information on vaccines, you can get help finding a nearby site, and you can get help arranging for transportation. Next slide. An important strategy for limiting COVID-19 transmission has been ensuring that schools have capacity to continue routine and/or response testing. This week, Public Health is distributing nearly 1 million additional at-home tests to public, charter, and independent private schools in areas of high need through partnerships with the LA County Office of Education and Haluna Health. The Centers for Disease Control and Prevention has also approved an additional 615,000 professional rapid tests for LA County schools through the White House Rapid Test Kit program. And the state is delivering this week over 170,000 at-home test kits for distribution to schools for staff testing needs. The ability to identify those who are asymptomatic and positive has led to less disruption at schools. On this slide, you can see school testing volume and test positivity over time. Testing volume is represented by the blue bars, and test positivity rate is represented by the purple trend line. For the third week in a row, the test positivity rate for schools has declined. Between January 24th and January 28th, over 486,000 tests were administered, with a test positivity rate of 4%. This is an approximately 70% decline in test positivity since the beginning of January, when test positivity, as you can see, was 14%. The safety measures that schools have implemented, along with the slowing that we're seeing of community transmission, has likely contributed to these declines, and the continued use of our public safety measures will help keep our schools safe and open. Next slide. We're currently investigating, as you can see here, 52 school outbreaks. This is up from 46 that were under investigation last week. Between January 23rd and January 29th, 18 new outbreaks were open, 4 in elementary schools, where we have the highest percentage of unvaccinated students, 1 in a high school, and 3 in youth sports. Despite recent increases in outbreaks, the number of school outbreaks is still relatively low, and it suggests that schools are successfully implementing recommended strategies to limit spread. Screening, this includes their screening and response testing, ensuring compliance with isolation and quarantine requirements, following recommended infection control guidelines, and the wearing of well-fitting masks that provide maximum filtration. Next slide. Pediatric COVID-19 vaccine doses for those 5 to 11 years of age, as well as boosters for adults, first doses for adults and for older students, are being offered at no charge at school-based vaccine clinics across LA County. There's over 900 school-based vaccine clinics scheduled for February, and there are 201 of these scheduled this week. 87% of the school clinics are held in communities that have lower rates of vaccination coverage. From February 2021 to February of 2022, over 5,800 school-based vaccination clinics have been held. Hopefully, by offering COVID-19 vaccinations at these trusted and convenient sites, we can improve vaccine access and uptake for all. Next slide. Before I close out with information regarding our planned approach for managing COVID-19 after our surge subsides, I'd like to provide a brief update on compliance with our masking requirements for businesses. When compliance is high, mask wearing is one of the most effective strategies for reducing the spread of COVID-19. Masking requirements can reduce transmission without much disruption to people's routines, while helping businesses reduce risk for their customers and their workers. Our health officer order requires that, with limited exceptions, all persons 2 years of age and older wear masks while in indoor public settings and businesses. Since January 17th, employers were also required to provide employees who work indoors and in close contact with other workers or with the public with well-fitting medical masks, surgical masks, or higher-level respirators, such as N95 or KN95 masks. These upgraded masks are better at blocking virus particles than cloth masks, and they do provide additional protection to workers and customers when transmission is so high. Between January 21st and January 27th, Public Health conducted more than 1,400 site inspections to assess vaccination verification and mask compliance, including whether employers were providing upgraded masks across a variety of businesses. And we're encouraged to see that compliance was near or above 90% among restaurants, bars, nightclubs, lounges, breweries, food markets, hotels, and food manufacturing plants. For customers wearing masks, employees wearing upgraded masks, and vaccination verification were applicable. For gyms, compliance for customer and employee mask wearing was around 80%. For garment manufacturers, compliance for employee mask wearing was at 74%. We appreciate that business communities and public adherence to these safety requirements. When transmission is lower, we will appropriately be relaxing some masking requirements, but we're not there yet. And although there's been inconsistent compliance, as we've seen in some settings, given the continued high numbers of new cases, including breakthrough cases, this is not the right time to stop wearing our masks when around others indoors and in crowded outdoor settings. Layering in the protection offered by a mask remains an important strategy for protecting our essential workers and reducing the transmission of this virus. Next slide. However, as our COVID-19 metrics continue to improve, it's important to plan for post-surge approaches that can minimize COVID-19 risk after our winter surge has ended. Post-surge does not imply that the pandemic is over, or that transmission is low, or that there will not be additional unpredictable waves of surges in the future that will require integrated public health measures. Rather, it acknowledges that we are stabilizing with consistent declines from the surge peak and realigns our current public health response to meet current mitigation needs. Public Health will consider LA County to be post-surge when COVID daily hospitalizations drop below 2,500 for 7 consecutive days. One of the most harmful consequences of this winter surge has been the extraordinary pressure on the healthcare system, forcing many hospitals to postpone routine services and divert patients to other settings. The return of most hospitals and healthcare facilities to providing the full range of services needed by patients and residents would be an indication of reduced danger to our county residents. The role of the LA County Department of Public Health post-surge continues to be to ensure an equitable distribution of the resources and opportunities needed to prevent COVID-19 transmission and protect residents and workers from devastating consequences associated with COVID-19 illness. As we've seen over the past 2 years, the pandemic has illuminated stark inequities in the burden of disease by race and ethnicity and geography, with Black and Brown individuals and those living in under-resourced communities experiencing higher case, hospitalization, and death rates. These disparities did not happen by chance, and they reflect decades of disinvestment, marginalization, and racism. Calls for minimizing public health response activities can have an unintended consequence of exacerbating inequitable outcomes, since the existing healthcare and social services systems are not adequately organized and supported to provide those most vulnerable and marginalized with the necessary resources to mitigate the impact of the virus. When we move into the post-surge phase, public health will continue to support an equity-focused response and will organize post-surge actions to protect the medically vulnerable, protect essential workers, protect hospitals and health system functioning, and support a subset of vital institutions, such as those that provide government services, schools, childcare, and emergency response. Public health, our partners, and our residents will continue to use all of the tools that are available to respond to the pandemic. And as new tools become available in the weeks and months ahead, various strategies will need to be realigned and modified. Today, I wanted to discuss one of the key mitigation strategies, masking. As I mentioned earlier, mask wearing is a very effective strategy for reducing COVID-19 transmission. Thus, as we move through the short term, masking will continue to be a key part of the post-surge COVID-19 strategy. Some changes, however, will occur soon. When LA County moves into the post-surge period, that's less than 2,500 hospitalizations for 7 consecutive days, masking will no longer be required while outdoors at outdoor mega events or in outdoor spaces at childcare and K-12 schools. In alignment with CDC recommendations, post-surge, masking will continue to be required for indoor establishments, including indoor offices and work sites, indoor events, and high-risk settings, until both of the following can be met. LA County has 2 consecutive weeks at or below moderate transmission. As defined by CDC, moderate transmission is less than 50 new cases per 100,000 persons in the last 7 days. And we also need to note that there should be no emerging reports of significantly circulating new variants of concern that threaten vaccine effectiveness. When vaccines aren't able to work so well, having a mask on becomes an imperative. Where there are federal and state regulations, masking will also continue to be required. This includes when riding public transit and in transportation hubs as required by the federal regulations, and indoor masking requirements at TK through grades 12 schools, childcare, youth settings, healthcare settings, correctional facilities, homeless and emergency shelters, and cooling centers as required by the state. Sites will need to continue to adhere to any applicable masking requirements that are included in state and LA County health officer orders or all facility letters for healthcare facilities. We'll be asking that employers continue to provide workers with high quality and well-fitting masks if their jobs put them in close contact with other workers or the public. Until transmission is low, we'll also continue to recommend that we keep our masks on whenever we're in close contact with others in indoor or outdoor crowded spaces. We know that throughout the pandemic, businesses and organizations have voluntarily put extra precautions in place to protect workers, customers, or the public. They'll continue to have the discretion to require masking of workers, customers, and the public. In closing, I'm grateful to everyone for continuing for 2 very long years to take care of each other and for taking responsibility to layer in masking and other protections that help us move closer to our post-surge phase and less virus transmission. I look forward to transitioning to post-surge. Thank you, and I'm happy to take your questions.
Thank you, Dr. Ferrer. As a reminder, if you have a question, you can message me, the host, or you may chat me your question and I would be happy to read it out. Our first question comes from Ryan Carter from LA Daily News. Ryan, go ahead.
Thank you, Dr. Dr. Ferrer. Do you see this actually reminds me of the tier system, the colored tier system from a couple of years ago now. Do you see a future where we will have a kind of an agreed upon threshold like that tier system that we'll just have to sort of live by as we go? And the other quick question is, why do you think, Dr. Ferrer, the pace of vaccination has slowed? Thank you very much.
Yeah, thanks so much, Ryan. Both great questions. I'm not, CDC still has a tiered system in place. They still group the entire country by levels of transmission, because it is important for all of us to acknowledge that, we do need to have a shared goal of reducing transmission, getting it down to as low a rate as possible. It protects those people most vulnerable from those serious consequences. It also helps for all of us prevent the proliferation of additional variants of concern that can cause more damage. So I think we have that shared desire, across the country, to go ahead and figure out what strategies make sense when you have higher transmission for trying to reduce spread. And when you get to lower transmission, what strategies make sense to keep ourselves at a relatively low rate of transmission. But you're right, we are tiering, our efforts here in LA County to making sure, as I noted, that, our healthcare system is fully functional, because we all need that, whether we have COVID or we have something else. And then to this goal of slowing spread. And, I think lots of people have different opinions, and they're all good. I mean, because at this point, this is an unpredictable virus. Like, we have learned that over the last 2 years, and no one has a crystal ball. But I think we've learned that because of this unpredictability, it makes sense to actually acknowledge that at different times during the year, we may need to use a different set of strategies. I also want to note that there's some exciting new tools that are going to be available soon. Therapeutics, for one. We have 2 oral therapeutics. They're in short supply right now, but soon they should be in good supply. And, again, another tool to help people not get so sick and certainly not tragically pass away. We're also, shortly, when the FDA and the CDC give approval, we're going to have vaccines for our youngest residents. And that too is another really powerful tool that helps extend the protections of our vaccines. And as we have those tools, then again, we have to go back, reassess, and say, with those tools, are some of the traditional public health measures still necessary? So I know everyone hates change. I know everyone wishes we could just say, here's how it's going to be for the next 2 years, or here's when we're going to get to the end of the pandemic. We're not there. We're not able to say that. But what we are able to say is the tools that we have right now kept us fully open during this surge. It came at a great cost. We had, hundreds of thousands, I'd say close to 1 million people infected over a very short period of time. Staffing shortages everywhere. That really did cause disruption. Many people sick, even those people who had relatively mild illness were sick. Lots of people ended up in our hospitals, and tragically, we lost lots of loved ones to COVID. But we're in much better shape than we were the prior winter surge, where we really didn't have all these tools and had to close down so many of the activities we love. So I see a future in front of us that allows us to live with COVID. But in doing so, we have to remember our obligations to each other, to take care of each other, and to put in place the protection measures that make sense when for a given sort of rate of transmission and the tools at hand to prevent that serious illness and death. In terms of, the slowdown on folks coming in to get vaccinated, I think, there's lots of, possible explanations. I will say that for many people, they still don't trust the vaccines, and that's why they're not getting vaccinated. I think other people are also worried because the vaccines aren't, 100% effective. And many people, they saw that many people who were vaccinated were still able to get infected. And that, again, for some is a reason to think, maybe I can wait, maybe it's not so important. I think others, unvaccinated, got infected and are hoping that they have enough immunity to get them through whatever's ahead. We urge people, look at the science. The best protections you have are if you get vaccinated. We all learned that people who were infected with Delta and weren't vaccinated really had a pretty high rate of reinfection from Omicron. So no guarantees moving forward with anything, except for the fact that so far the vaccines, and particularly the vaccines and the boosters, have really given us that optimal protection, even with Alpha, with Epsilon, with Delta, and now with Omicron. So I think, you get your best protection from the vaccines. But, folks have their reasons for not coming in yet to get their first dose. I think what's more puzzling are the people who are waiting to get their boosters. These are all people fully vaccinated. I urge folks, I hear from folks, when I'm at one of our sites, they're waiting because they think there's going to be a better booster shortly, or a better vaccine, or an Omicron specific vaccine. And those vaccines are months away. There still are safety protocols, there still are clinical trials that vaccine developers have to go through, and a very rigorous review. So I urge people not to wait. Again, we don't know exactly what's in the future, but right now we do know that the boosters make a really big difference in how much protection you have, and that means in how much protection our community as a whole is going to have. I'll take the next question.
Our next question comes from Lauren Lister from KTLA. Lauren, you're unmuted.
Thank you, Dr. Ferrer. Thanks so much for taking my question. There is an effort getting underway by a group to try to repeal the City of LA's ordinance that requires COVID-19 vaccines at certain businesses like restaurants and gyms. The city clerk has approved a petition to circulate. I'm wondering, from your perspective, is there at this point in the pandemic a public health justification for the city's vaccine mandate ordinance?
Well, the vaccines work, and they provide the most protection that we can possibly get. And I think that was the intention, to really make it possible for us to stay open. And I think, again, I reported almost 12,000 new cases today. So we're not on the low side of transmission. We're on the downward side of a big, big surge. But we still have a lot of cases here, and we have a lot of transmission. And anything we can do to really help us get to a lower level of transmission, I think is appropriate still. So thanks for that.
Our next question. My apologies. Our next question comes from Jackie Foitier from KPCC. Jackie, go ahead.
Hi. Where do restaurants and bars fall in the post-surge masking requirements? And then would there be a scenario where under Cal OSHA standards, employees would have to stay masked, but not, customers? Thank you.
Yeah, thanks so much, Jackie. And for the last question, I mean, that's why I said, there are state regulations, there are Cal OSHA regulations. The county can never be less restrictive than those regulations. So yes, there's the possibility always that we could wish to move in a direction, but not be able to, because there are other regulations that are in place that we all have to adhere to. In terms of bars and restaurants, I mean, the indoor portions of bars and restaurants for masking, there's required masking until we get to moderate transmission. That's, the CDC has that recommendation out there as well for the entire country. Masks remain an important tool to continue to use until we're at moderate transmission. So, and again, that's for the indoor portion. So outdoor portions of bars and restaurants currently don't have a masking obligation and won't have one, post-surge either.
All right, our next question comes from Ron Lin from the LA Times. Ron, go ahead.
Hi, Dr. Furr. Thanks so much for taking our questions. Really appreciate it. Questions today are on hospitals, the new mask policy you outlined, vaccine policy, and that petition. So first, Orange County has said that hospitals there are still strained, and some hospitals are still not doing some scheduled surgeries. Are hospitals in LA County still strained? And how did you come to that threshold of 2,500 hospitalizations as the magic number to ease masking in outdoor settings? Two, your criteria to lift masking in indoor offices and work sites is based off of cases. Some of the Bay Area counties have suggested they're going to look at more at hospitalizations as a key criteria. That said, I understand the Bay Area's vaccination booster rates are better than the LA counties. Can you talk about why you still chose to go with cases for lifting that masking requirement in indoor settings, and when you would imagine we would get there, mid-March, mid-May? Third, in terms of the vaccination criteria, San Francisco is now allowing unvaccinated people to go into indoor bars and restaurants, but only if they show a recent negative test. And if I have this right, LA County doesn't allow unvaccinated people to go into indoor bars, and LA City requires unvaccinated people to use the outdoor section of restaurants if an outdoor portion is available. Do you think it makes sense to either tighten vaccine requirements for people entering businesses to include boosters, or eventually loosen vaccine requirements if people get a recent negative test? And just I'm sorry to ask a fourth question, but the LA City clerk, in regards to that petition, if that petition to repeal the LA City masking mandate does make it to the ballot and is successful, if LA County orders still apply, those would still remain valid, right? Thank you.
Yeah. So your last question, you're right, Ron. I mean, LA County orders, very much more narrowly focused on bars, lounges, nightclubs, breweries, wineries, distilleries. Those would remain in effect. That petition isn't about repealing LA County's requirements, health officer order. So those will remain in effect. You asked a lot of questions. I don't really have all the answers since some of it is, again, looking into the future. I want to start by saying we're all going to need to be very flexible looking into the future, because as things change, then the strategies have to change. So I know where we are today, and I can predict for the next few weeks what might make sense. But as I said, once we get more therapeutics, once we get, we're able to protect our youngest residents, it's time to, again, do these reassessments about what strategies make the most sense. I'll start with the question on cases, because I think there is an important reason for continuing to look at cases. Regardless of how you look at all of the different metrics that we can use to assess where we are in this pandemic and what's going on, the number of people infected still really drives the number of people that end up being hospitalized, and the number of people, tragically, who end up then passing away. It also drives the ability of transmission to spread to the extent that you create a very hospitable environment for the development of new variants of concern. So I think we have to still pay attention to transmission, and we can't just focus on protecting, which is absolutely essential. We can't just focus on protecting the healthcare system. While that's a high priority, and we will always keep it as a high priority, we also want to keep transmission levels as low as we can, at least in this period of time that we're in now, where we don't have access to those oral therapeutics at a level that provides reassurance that most people, even if they get infected, are not going to have a bad outcome. We also need to worry about transmission because of the equity issues. Who's getting infected and why? So there's a whole host of workers who have to go to work every day, and they serve many of us because of the work that they're doing. And again, right now, given the tools that we have, protecting those workers remains essential. And high rates of transmission means that there are more exposures at all of those sites where workers are. So we're going to, again, continue to want to layer in a protection for workers that's as non-disruptive as possible, but allows for them to feel that they're not having what I would call sort of unnecessary exposures at a workplace where they really, frankly, have to go and are in service of the rest of us. So you know, I think we're going to stay for now with using that. I'm also going to point out that CDC also has their recommendations around masking still tied to transmission. I think for the same reason, you know, transmission still matters a lot. And as I've shown, like Omicron is milder than Delta and then some of the ancestral strains, but let's not fool ourselves that this is inconsequential illness, because for many people it's not. And right now it's still at a rate higher than the rate we usually experience for other respiratory illnesses. So we want to continue to, in this short run, you know, really take very good care of each other, add in those protections. The way we got to 2,500 is, frankly, we work very closely with the hospitals. And that's why, again, I say most hospitals in LA County, when we have sustained a week at being at 2,500 or less, hospital admissions feel pretty comfortable that that means they can return to being able to do most of their customary business. And that for us is important because we've all seen the data on higher rates of mortality across the board for all kinds of other diseases during the pandemic, which probably reflects in part people's access to healthcare services. So we want to make sure that, again, as part of protecting our healthcare system, we're protecting it so that the customary and frankly essential services that healthcare providers are offering us will be able to resume. And you know, we get indications that, you know, that's a threshold that makes sense. You know, it's not going to be perfect, and certainly, as you noted, there are some hospitals, even in LA County, that continue to struggle. But you know, we're a very large county, and in order to move forward, we really have to look at the information we're going to be able to get from the majority of our hospitals and what they feel is possible, and then continue to work with the MOAC and with the Department of Health Services to ensure that all of our hospitals continue to get the resources they need during this pandemic. And in terms of your questions about the vaccines and the mandates and the changes, you know, I appreciate, you know, things are pretty different up north right now. You know, there's masks can come off, but that's because everybody has to be vaccinated. And I appreciate what you're saying is that, you know, they're moving towards looking at opening up some of the sites for people that are unvaccinated. Again, I'm just going to say, you know, in this very near future, where we still have a lot of transmission, our bars are one of the highest risk settings, and we think it's a good idea for customers to be vaccinated because they primarily don't have their masks on while they're indoors. I think I got to just about everything. I hope so. But
Dr. Ferrer, we have a really quick follow-up from Jackie Foitier. Jackie, go ahead.
Oh, I was wondering who defines variants of concern, or using the CDC or the WHO's definition?
yeah, I mean, we look at what, you know, obviously we track what the WHO determines as a variant of concern and start looking at the evidence around that designation, and then, you know, really pay a lot of attention to CDC. But oftentimes, you know, the WHO is a little bit faster on this because they're responsible for the whole world and they get information from all of the countries. There's lots of variants of interest that have cropped up that haven't been given a designation as a variant of concern, but you know, we do, you know, pay a lot of attention to what's happening in other parts of the world because, as we've all seen, variants of concern travel and travel rather rapidly to all different parts of the globe. So I'm only going to have time, unfortunately I have a hard stop today. I'm only going to have time for one more question.
Okay, our last question comes from Peter Nichols from Melrose Action. Peter, go ahead.
Hey, Dr. Ferrer, thank you for a quick question. So, hey, our community is mobilizing a vaccination day clinic with Cedars-Sinai. How do we partner with you guys? Because I keep asking and I'm not getting a response. Help.
Oh, I'm so sorry. Peter, if you can just send a note to our communications team, we will get the vaccine team to reach out to you. And thank you so much for doing that. But yes, just send a note to the communications box and they'll send it to the vaccine team and they'll make sure somebody reaches out to you right away. We're always happy to help. So thanks for doing that. And
All
with
right.
that, thank you. Thank you, everyone. Appreciate all of your help and, really, really glad we're certainly on the downside of the surge and look forward to speaking with you again next week.
Thank you so much, Dr. Ferrer. For those of you whose questions we did not get to, please go ahead and send us a message to the media inbox at media@ph.lacounty.gov. We appreciate you spending time with us today. If you want to stay on, the Spanish portion of the briefing will be next. Hi, Monica. Can you hear me?
Hello, Kim.
Would you like to go ahead and get started?
Yes.
Okay, I have your slides ready to go. There we go. I can see you now.
Okay, thank you so much, Kim. Buenas
Hang on,
tardes.
I can do the end. I just wanted to get your camera on. Thank you so much, everyone, for joining us today. Today is February 3rd. This is the Spanish portion of today's briefing. We have Monica presenting. Monica, when you are ready.
Okay, thank you so much, Kim. Buenas tardes y gracias por acompañarnos esta tarde. Agradecemos la oportunidad de brindarle una vez más la más reciente información sobre la pandemia de COVID-19. En la sesión informativa de hoy compartiremos nuestras cifras actuales de casos, hospitalizaciones, muertes y variantes, nuestros últimos datos de la cobertura de vacunación, Una actualización sobre las escuelas incluida información sobre pruebas, brotes y puestos de vacunación en los planteles educativos, información sobre el cumplimiento de las empresas del requisito de uso de mascarilla revisado, información sobre nuestro plan para prevenir y controlar el COVID-19 a medida que disminuye el pico de la pandemia. First slide, please. Comenzamos con la actualización habitual de nuestras actuales cifras de COVID-19. La semana pasada anunciamos que después de semanas de altos números, la cantidad de casos de COVID-19 informados diariamente, nuestra tasa de resultados positivos de la prueba y las hospitalizaciones estaban disminuyendo. Hoy nos complace compartir que aunque todavía tenemos mucho camino por recorrer para volver a los niveles previos al aumento, continuamos viendo disminuciones reales en cada uno de estos números esta semana. Hoy informamos 11.548 casos nuevos, es decir, cerca de un cuarto de la cantidad que informamos hace varias semanas cuando alcanzamos nuestro récord de casi 46.000 casos en un solo día. El número promedio de casos nuevos diarios informados durante los últimos 7 días se redujo a cerca de 15.600 del promedio de aproximadamente 28.000 de los 7 días anteriores. La tasa de casos diarios promedio durante los últimos 7 días es ahora de 154 casos por cada 100.000 habitantes. Los CDC calculan las tasas de casos semanales y muestra que el condado de Los Ángeles tiene más de 1.500 casos por cada 100.000 residentes. Esto clasifica al condado de Los Ángeles como un área de alto contagio. Además, nuestra tasa promedio diaria de resultados positivos de la prueba ha disminuido a 8% hoy con respecto al 11% de hace una semana. La cantidad de personas que necesitan ser hospitalizadas debido al COVID-19 también ha bajado sustancialmente. Por primera vez en varias semanas, nuestras hospitalizaciones diarias se han reducido a menos de 3.500. Hoy informamos 3.398 nuevas hospitalizaciones y el promedio de hospitalizaciones diarias durante los últimos 7 días fue aproximadamente 3.800. En comparación, el jueves pasado nuestro promedio de 7 días de hospitalizaciones diarias fue de aproximadamente 4.600. A pesar de esta alentadora noticia, lamentablemente no hemos visto una disminución correspondiente en las muertes reportadas y cada día seguimos perdiendo docenas de personas en el condado a causa de COVID-19. Durante la semana pasada hubo un promedio de 70 muertes reportadas cada día. Enviamos las más sinceras condolencias y deseos de alivio a todos los que han perdido a un ser querido por COVID. Next slide, please. Esta diapositiva muestra los casos, hospitalizaciones y las muertes desde el 1 de julio pasado a hoy. Aquí puede ver los fuertes aumentos de casos y hospitalizaciones que ocurrieron durante la oleada del invierno, seguidos de una disminución constante durante las últimas 2 semanas. Si bien este reciente descenso es muy alentador, tanto los casos como las hospitalizaciones siguen siendo bastante altos, especialmente en comparación con las bajas cifras que vimos durante gran parte del año pasado. Además, las muertes en la línea azul continúan con una tendencia ligeramente ascendente, debido a que las muertes van a la saga de los casos y las hospitalizaciones. Tenemos la esperanza de que en las próximas semanas comencemos a ver menos personas fallecen debido a COVID-19. Sin embargo, si queremos que nuestros casos, hospitalizaciones y muertes estén cerca a los niveles que veíamos antes del aumento que experimentamos en el invierno, necesitaremos continuar con las medidas de protección de sentido común, que sabemos que pueden reducir el ritmo de contagio de COVID-19. Estas incluyen usar mascarilla cuando esté cerca de otras personas hasta tanto el contagio sea mucho menor. Hacerse la prueba, si es posible, cuando esté en reuniones, especialmente si habrá personas cuya salud estaría en alto riesgo si llegaran a infectarse. incluidos los no vacunados, estuvo expuesto a un caso positivo o se congrega en lugares concurridos bajo techo y donde no siempre las personas usan mascarillas. Quédese en casa y lejos de los demás si está enfermo y vacúnese y reciba el refuerzo si aún no está al día. Next slide, please. Desde el comienzo de la pandemia hemos estado monitoreando de cerca e informando sobre las muertes relacionadas con COVID. Hemos compartido nuestros conteos diarios y compartiremos nuestro análisis actualizado de las tasas de mortalidad también por estado de vacunación hoy. Nos gustaría dar un paso atrás hoy e informar la cantidad acumulada de muertes relacionadas con COVID que hemos tenido en el condado desde el comienzo de la pandemia. Estos datos se derivan de las cifras de certificados de defunción e incluyen las muertes de las ciudades de Long Beach y Pasadena durante el periodo del 1 de marzo del 2020 al 31 de diciembre del 2021. Para comparar los datos con respecto a otras causas de muerte, los recuentos de COVID-19 registrados en esta diapositiva se basan en la cantidad de certificados de defunción. Los recuentos diarios acumulados de muertes por COVID-19 que normalmente informábamos tienen en cuenta a estos, así como otras fuentes de datos, incluidas las muertes informadas por los hospitales, las clínicas, los informes de entrevistas y las investigaciones de brotes. Según los datos de los certificados, entre el 1 de marzo del 2020 y el 31 de diciembre del 2021, COVID-19 fue la principal causa de muerte en el condado de Los Ángeles, con 24.947 muertes por COVID. Antes de la pandemia, la principal causa de muerte aquí en el condado era la enfermedad coronaria. Y aunque el número de muertes por esta afección sigue siendo muy alto, durante estos 22 meses la cardiopatía coronaria representó 21.513 muertes. Muchos han notado que COVID se siente como la influenza. Sin embargo, como puede ver, durante los mismos 22 meses hubo muchas menos muertes por enfermedades respiratorias, es decir, 3.422 muertes por neumonía e influenza registradas en los certificados de defunción. Es de destacar que las medidas que implementamos para prevenir la propagación de COVID probablemente también condujeron a una transmisión significativamente menor de otras enfermedades respiratorias durante el periodo del informe. Y si bien las vacunas y el tratamiento ofrecen una poderosa protección contra la muerte, incluso nuestras cifras recientes continúan destacando cómo, en comparación con otras enfermedades respiratorias, el COVID sigue siendo más letal. Para el mes de diciembre observamos 396 muertes por COVID y 163 muertes por predominio de Omicron, que generalmente causa una enfermedad menos grave que las variantes anteriores. Las muertes por COVID continúan superando con creces las muertes por otras enfermedades respiratorias. A nivel nacional, un análisis del periódico New York Times publicado ayer reveló que Estados Unidos ahora tiene una tasa de mortalidad por COVID mucho más alta que otros países grandes de alto riesgo, de altos ingresos. Su análisis reveló que los estadounidenses ahora están muriendo de COVID-19 a casi el doble de la tasa diaria de los británicos y 4 veces la tasa de los alemanes. Los autores identificaron varios factores que probablemente contribuyeron a esto y sugirieron que las tasas más bajas de vacunación y refuerzo en los Estados Unidos pueden ser una razón principal. Estos hallazgos locales y nacionales nos recuerdan que COVID ha provocado enfermedades y muertes absurdas y el aumento de las tasas de vacunación y el refuerzo ofrece la mejor esperanza para reducir el resultado más trágico de la infección por COVID. Next slide, please. Mientras observamos con optimismo la disminución de casos y hospitalizaciones, también estamos atentos a la subvariante BA.2 de Omicron que se ha encontrado en el condado. Los científicos están estudiando de cerca BA.2 para determinar si en comparación con la BA.1, la cepa de Omicron más común que circula actualmente, se puede propagar más fácilmente de persona a persona, provocar enfermedades más graves o ser más resistente a tratamientos o vacunas. Se han publicado algunos hallazgos preliminares, pero como es el caso con otras variantes que surgen, estos pueden revisarse a medida que se desarrolla la ciencia. Los hallazgos iniciales sugieren lo siguiente. Las vacunas COVID-19 pueden ofrecer niveles similares de protección contra la enfermedad sintomática causada por BA.1 y BA.2. Los primeros análisis hechos por la Agencia de Seguridad Sanitaria del Reino Unido estimaron que la eficacia de la vacuna contra la enfermedad sintomática 2 semanas después de recibir una dosis de refuerzo fue del 63% para BA.1 y del 70% para BA.2, 2 semanas después de recibir una dosis de refuerzo. BA.2 parece ser un poco más contagiosa que BA.1. Sin embargo, se necesitan más estudios para comprender la capacidad que tiene BA.2 para infectar y determinar si se propaga más fácilmente que la BA.1. Aunque no se sabe mucho sobre la gravedad de la enfermedad causada por BA.1, sin embargo, hallazgos muy tempranos han sugerido que BA.2 actúa de manera diferente, no actúa, perdón, de manera diferente ni conduce a una enfermedad más grave a nivel de población que el BA.1. Mientras los científicos trabajan para comprender mejor las diferencias potenciales entre BA.1 y BA.2, Salud Pública está monitoreando los resultados de las secuencias. Tenga en cuenta que siempre hay retrasos en la secuencia que afectan los totales de las semanas más recientes, pero en esta diapositiva vemos los datos más recientes sobre variantes secuenciadas aquí en el condado de Los Ángeles. La barra roja representa Omicron, la variante que domina en el condado, y la barra azul representa la variante Delta. La barra amarilla, apenas visible, representa otras variantes. Como puede ver, el 99,9% de los especímenes secuenciados para el último periodo del informe eran Omicron, la variante que impulsó nuestro aumento invernal. Estamos monitoreando la propagación de la subvariante BA.2 de Omicron y a la fecha hemos identificado 17 casos de esta variante en el condado de Los Ángeles. Next slide, please. Como de costumbre, también compartimos nuestras líneas de tendencia actualizadas de casos, hospitalizaciones, admisiones en las unidades de cuidados intensivos y muertes desglosadas por estado de vacunación. Nuestros datos continúan mostrando que en comparación con las personas no vacunadas, quienes están completamente vacunados tienen menos probabilidades de infectarse con COVID, ser hospitalizados debido a COVID-19, requieren atención médica en una unidad de cuidados intensivos o mueren a causa de COVID. Además, sugieren que si bien estar completamente vacunado brinda una fuerte protección, las personas que estuvieron mejor protegidas contra la infección y enfermedad grave por COVID-19 son aquellas que recibieron todas las dosis de la vacuna y el refuerzo. Estamos viendo primero los casos por estado de vacunación. Esta diapositiva muestra la ocurrencia de COVID-19 para 3 grupos. Individuos no vacunados representados por las líneas de puntos, personas que están completamente vacunadas pero que no recibieron su dosis de refuerzo representadas por líneas discontinuas, e individuos que recibieron todas las dosis requeridas de la vacuna y el refuerzo representados por las líneas continuas. Aquí puede ver claramente nuestra disminución reciente en los casos de COVID-19. Para la semana que finalizó el 22 de enero de 2022, quienes estaban completamente vacunados pero no habían recibido el refuerzo tenían aproximadamente 2 veces menos probabilidades de infectarse con COVID-19 que las personas no vacunadas. Aquellos que estaban completamente vacunados y recibieron una dosis de refuerzo estaban aún más protegidos y tenían aproximadamente 4 veces menos probabilidades de contraer COVID-19 que las personas no vacunadas. Next slide, please. Esta diapositiva muestra la distribución por edades de nuestros casos de enero de 2022 en comparación con la distribución por edades de la población general del Condado de Los Ángeles. El mayor porcentaje de casos se notificó en el grupo de edad de 30 a 49 años, seguido del grupo de edad de 18 a 29 años, que en conjunto representaron casi la mitad de los casos notificados en enero. Si bien los niños representaron menos casos que estos grupos, los menores de 5 a 11 años y de 12 a 17 años representaron una mayor proporción de casos en relación con su participación en la población total. Por ejemplo, los niños de 12 a 17 años representaron el 13% de los casos de enero, pero solo el 7% de la población del condado de Los Ángeles. Y los niños de 5 a 11 años representaron el 15% de los casos de enero, aunque comprendieron solo el 90% de la población del condado de Los Ángeles. Las tasas más altas de pruebas en esta población en edad escolar puede haber contribuido a la mayor proporción de casos en los grupos de edad de 5 a 11 y de 12 a 17 años. De todas formas, estos datos muestran que los niños se infectan con COVID-19. Solo en enero de 2022 hubo casi 265,000 casos entre niños de 0 a 17 años que se reportaron a salud pública, de los cuales alrededor de 234,000 fueron entre niños de 5 a 17 años. Algunos de estos niños se enfermaron de COVID-19. Es todo lo que se necesita para faltar a la escuela y para no participar en actividades escolares. Y dada la alta capacidad de programación de Omicron, algunos podrían infectar a personas vulnerables en el hogar, la escuela, las guarderías y en entornos comunitarios. Por lo tanto, es importante que mientras el contagio sigue siendo alto, continuemos, con las medidas de sentido común para reducir la proliferación del virus entre los niños, incluido el uso de mascarilla, las pruebas y la mejora de los niveles de cobertura de vacunación entre esta población. Next slide, please. Al igual que con los casos, en esta diapositiva puede ver un fuerte aumento en las hospitalizaciones relacionadas con COVID hace unas semanas, seguido de una prometedora caída reciente. Y revisar nuestros últimos datos de hospitalización, vemos diferencias aún más sorprendentes en los resultados entre las personas vacunadas y las no vacunadas que las que vimos en los casos. Esta diapositiva muestra las hospitalizaciones por COVID por estado de vacunación. Durante la semana que finalizó el 22 de enero, los residentes que estaban completamente vacunados, pero que no habían recibido una dosis de refuerzo, tenían aproximadamente 6 veces menos probabilidades de ser hospitalizados con COVID-19 que los que no estaban vacunados. Aquellos que estaban completamente vacunados y habrían recibido su dosis de refuerzo tenían niveles aún más altos de protección y aproximadamente 22 veces menos riesgo de ser hospitalizados que las personas no vacunadas. Next slide, please. Durante el aumento de este invierno, a medida que incrementaron las hospitalizaciones por COVID-19, también vimos un creciente número de pacientes con COVID-19 que requirieron atención en la unidad de cuidados intensivos. En el pasado no podíamos calcular tasas estables separadas por estado de refuerzo porque había muy pocos pacientes vacunados y con refuerzos en urgencias. Sin embargo, a partir del 3 de enero, hemos contado con suficientes números para incluir este grupo que se puede ver en la línea continua corta. Estos datos muestran que las personas no vacunadas tenían más probabilidades de requerir atención en las unidades de cuidados intensivos que los pacientes con COVID que estaban completamente vacunados con refuerzo tenían menos probabilidades de ser admitidos en urgencias. Para el periodo que finalizó el 22 de enero, los residentes que recibieron todas las vacunas y el refuerzo tenían un riesgo 31 veces menor de necesitar atención de urgencias que los que no estaban vacunados. Las personas completamente vacunadas que no recibieron una dosis de refuerzo tuvieron aproximadamente 8 menos probabilidades de ser admitidos en cuidados intensivos que las personas no vacunadas. Next slide, please. Cuando revisamos nuestras tasas de mortalidad por estado de vacunación, no pudimos calcular tasas estables para individuos vacunados separados por estado de refuerzo porque hubo muy pocas muertes de personas que fueron vacunadas y recibieron el refuerzo. Por lo tanto, en esta diapositiva solo estamos comparando las muertes entre todas las personas completamente vacunadas con o sin refuerzo y las personas no vacunadas. Como fue el caso de las infecciones y las hospitalizaciones, al observar las muertes, encontramos que las personas no vacunadas sufrieron peores resultados que las personas vacunadas. Para el periodo que finalizó el 15 de enero de 2022, las personas completamente vacunadas tenían una probabilidad 12 veces menor de morir de COVID que las que no estaban vacunadas. Cuando consideramos estos datos sobre muertes junto con los datos de casos, hospitalizaciones y de cuidados intensivos, sigue siendo claro que las vacunas continúan brindando una protección significativa contra el COVID-19, especialmente contra enfermedades graves y la muerte. Nuestros datos también muestran que las dosis de refuerzo agregan una capa importante de protección contra enfermedades y afecciones graves. Next slide, please. Dada la eficacia de las vacunas, nos alivia ver aumentos graduales en los niveles de cobertura de vacunación. Por ejemplo, entre el 2 y el 30 de enero, el porcentaje de residentes de 5 años o más que recibieron al menos una dosis aumentó del 79% al 82% y el porcentaje de personas en este rango de edad que estaban completamente vacunadas aumentó del 71% al 73%. Este es un buen progreso dentro de un mes, pero para protegernos mejor contra COVID-19 necesitamos, uno, aumentar las tasas en todos los grupos de edad de las personas más jóvenes, en particular la de los niños de 5 a 11 años, grupo en el que solo el 32% ha recibido al menos una dosis de la vacuna, y dos, proteger a más personas con las dosis de refuerzo. Todas las personas mayores de 12 años sin contraindicaciones han sido aprobadas para recibir esta dosis, pero al 30 de enero solo el 37% la había recibido. Next slide, please. Hay casi 1,8 millones de residentes de 5 años en adelante que han sido aprobados para recibir su primera dosis de COVID-19, pero no la han recibido. Y casi 2,7 millones de residentes de 12 años en adelante que no han recibido una dosis adicional o de refuerzo cuando se puede recibir. Las vacunas COVID-19 están fácilmente disponibles en los centros de salud pública, consultorios, clínicas, farmacias, escuelas, sitios de alcance a la comunidad y otros lugares convenientes en todo el condado. Esta diapositiva muestra el número de la primera, segunda y la refuerzo administradas a lo largo del tiempo. Nuestro ritmo se ha desacelerado recientemente con alrededor de 185,000 de la primera dosis, la segunda y el refuerzo administrados entre el 24 y el 30 de enero, frente a casi 380,000 de esas dosis administradas entre el 6 y 12 de diciembre. Hasta que estos números aumenten, seguirá habiendo enfermedades y muertes por COVID que se pueden prevenir con las vacunas. Para obtener más información sobre las vacunas contra el COVID y encontrar un puesto de vacunación cercano, Los residentes pueden visitar vacunatelosangeles.com o llamar a la Central Telefónica de Salud Pública al 833-540-0473 entre las 8 de la mañana y las 8:30 de la noche, los 7 días de la semana. Las vacunas son gratis, independiente del seguro médico y el estado migratorio. Next slide, please. Una estrategia importante para limitar el contagio de COVID-19 ha sido garantizar que las escuelas tengan la capacidad de continuar haciendo pruebas de rutina y o de respuesta a la posible infección. Esta semana, Salud Pública está distribuyendo en las escuelas públicas, charter e independientes o privadas en áreas de alta necesidad casi 1 millón de pruebas para hacerse en el hogar en asocio con la Oficina de Educación del Condado de Los Ángeles y el Luna Health. Los CDC también aprobaron 615,000 pruebas rápidas profesionales adicionales para las escuelas por medio del programa de juegos de pruebas rápidas de la Casa Blanca y del Estado. Y así, esta semana está agregando más de 170,000 juegos de pruebas para hacerse en casa, los cuales se distribuirán a las escuelas para cubrir las necesidades de pruebas del personal. La capacidad para identificar aquellos que son asintomáticos pero fueron diagnosticados como positivos al virus ha llevado a una menor interrupción en las escuelas. En esta diapositiva puede ver el volumen de pruebas hechas en las escuelas y las cifras de las pruebas con resultado positivo a lo largo del tiempo. El volumen de pruebas está representado por las barras azules y las tasas de casos positivos con base en la prueba está representada por la línea púrpura. Por tercera semana consecutiva, la tasa de resultados positivos en las escuelas ha disminuido. Entre el 24 y 28 de enero se administraron más de 486,000 pruebas con una tasa de casos positivos de 4,4%. Esta es una disminución de cerca del 70% desde principios de enero, cuando esta tasa era del 14%. Las medidas de seguridad que se han implementado en las escuelas, junto con la más lenta propagación en la comunidad, probablemente han contribuido a estas disminuciones. El uso continuo de estas medidas puede ayudar a mantener las escuelas seguras y abiertas. Next slide, please. Salud Pública está investigando un total de 52 brotes escolares, frente a los 46 que estaban bajo investigación la semana pasada. Entre el 23 y el 29 de enero se desataron 18 nuevos brotes, 14 en escuelas primarias y uno en escuela preparatoria y 3 en deportes juveniles. A pesar de este aumento, la cantidad de brotes en las escuelas es relativamente baja y sugiere que los planteles continúan implementando con éxito las estrategias recomendadas que limitan la propagación, como las pruebas para detectar la infección y las que son para responder al virus. Cumplen con los requisitos de aislamiento y cuarentena, acatan las pautas recomendadas para el control de infecciones y promueven el uso de mascarillas ajustadas que brinden la máxima filtración. Next slide, please. Las dosis de la vacuna pediátrica para niños de 5 a 11 años, así como los refuerzos para estudiantes de 12 años y mayores que reúnan los requisitos, se ofrecen sin costo alguno en los puestos de vacunación en las escuelas de todo el condado. En febrero se instalarán más de 900 sitios de vacunación en los planteles y 201 de ellos estarán operando esta semana. El 87% de esta semana se llevan a cabo en comunidades con tasas más bajas de cobertura de vacunación. Desde febrero de 2021 hasta febrero del 2022 se han establecido más de 5,800 clínicas de vacunación en las escuelas. Al ofrecer vacunas contra el COVID-19 en estos sitios confiables y convenientes, esperamos mejorar el acceso y que todos acepten las vacunas. Next slide, please. Antes de cerrar con información sobre nuestro enfoque para manejar COVID-19 Después de que el pico de la pandemia baje, nos gustaría brindar una breve actualización sobre el cumplimiento de nuestros requisitos de uso de mascarilla en las empresas. Cuando el acatamiento es alto, el uso de mascarillas es una de las estrategias más eficaces para reducir la propagación de COVID-19. Los requisitos de uso de mascarilla pueden reducir el contagio sin interrumpir demasiado la rutina de las personas, al tiempo que ayudan a las empresas a reducir el riesgo para sus clientes y trabajadores. Nuestra orden del oficial de salud requiere que, con excepciones limitadas, todas las personas mayores de 2 años y mayores usen cubrebocas mientras están bajo techo en lugares públicos y empresas. A partir del 17 de enero, también se solicitó a los empleadores que proporcionen a los empleados que trabajan en interiores y que están en contacto cercano con otros trabajadores o el público, que ofrezcan mascarillas médicas, quirúrgicas o de nivel superior, como la N95 o KN95, y que todas se usen bien ajustadas. Estos son mejores cubrebocas para bloquear las partículas del virus que las de tela. Brinda protección adicional a los trabajadores y a los clientes. Next slide, perdón. Entre el 21 y el 27 de enero, Salud Pública realizó más de 1,400 inspecciones en una variedad de negocios para evaluar si estaban verificando el estado de vacunación y si cumplían con el uso de tapabocas, incluso si los empleadores estaban dando mejores mascarillas. Y nos complació ver que el acatamiento estuvo cerca o por encima del 90% en los restaurantes, bares, clubes nocturnos, discotecas, cervecerías, mercados de alimentos, hoteles y plantas de fabricación de alimentos. En los gimnasios, el cumplimiento del uso de mascarillas por parte de los clientes y empleados fue de alrededor del 80%. En las fábricas de prendas de vestir, el cumplimiento del uso de mascarillas por parte de los empleados fue del 74%. Agradecemos la adhesión de la comunidad empresarial y del público a estos requisitos de seguridad. Cuando la transmisión sea más baja, relajaremos apropiadamente algunos requisitos del uso de mascarilla, pero aún no hemos llegado allí. Aunque ha habido un cumplimiento inconsistente en algunos entornos, dado el alto número continuo de casos nuevos, incluidos los casos post-vacunación, este no es el momento adecuado para dejar de usar las mascarillas cuando estamos cerca de otras personas, en lugares cubiertos y en entornos al aire libre llenos de gente. Las capas de protección que incluyen el uso de mascarillas siguen siendo una estrategia importante para proteger a nuestros trabajadores esenciales y reducir la propagación del virus. Next slide, please. Sin embargo, a medida que nuestras cifras de COVID-19 continúan mejorando, es importante planificar acciones para enfrentar el panorama después de que pase el pico de casos que hemos visto en el invierno, para reducir el riesgo que el COVID-19 representa para la comunidad. Posterior a la oleada no implica que la pandemia ha terminado, que el contagio sea bajo o que no habrá picos adicionales impredecibles en el futuro que requerirán de medidas integrales de salud pública. Más bien, reconoce que nos estamos estabilizando con disminuciones constantes desde el pico máximo y realinea la respuesta actual de salud pública para satisfacer las necesidades actuales de mitigación. El Departamento de Salud Pública considerará que el Condado de Los Ángeles ha entrado a la fase posterior a la oleada cuando las hospitalizaciones diarias por COVID caigan por debajo de 2,500 durante 7 días consecutivos. Una de las consecuencias más dañinas del aumento de este invierno ha sido la extraordinaria presión sobre el sistema de salud, que obligó a muchos hospitales a posponer los servicios de rutina y enviar a los pacientes a otros entornos. Si la mayoría de los hospitales y centros de atención médica pueden volver a brindar a los pacientes la gama completa de servicios que ellos necesitan, sabríamos que el peligro se ha reducido. El papel de salud pública para manejar la fase posterior a la oleada continúa siendo garantizar una distribución equitativa de los recursos y oportunidades necesarios para prevenir la propagación de COVID-19, así como proteger a los residentes y trabajadores de las consecuencias devastadoras asociadas con la enfermedad de COVID-19. Como hemos visto en los últimos 2 años, la pandemia ha puesto de manifiesto las marcadas desigualdades entre razas, etnias y ubicación geográfica. Las personas afroamericanas y de color y aquellas que viven en comunidades de escasos recursos han experimentado tasas más altas de casos, hospitalización y muerte. Estas disparidades no ocurrieron por casualidad y reflejan décadas de falta de inversión, marginación y racismo. Los llamados para minimizar las actividades de respuesta de salud pública pueden tener la consecuencia no deseada de exacerbar los resultados inequitativos, ya que los sistemas de servicios sociales y de atención de salud existentes no están adecuadamente organizados y respaldados para proporcionar a los más vulnerables y marginados los recursos necesarios para mitigar el impacto del virus. Cuando pasemos a la fase posterior a la oleada, Salud Pública continuará apoyando una respuesta centrada en la equidad y pondrá en marcha acciones para proteger a las personas con un estado de salud vulnerable, especialmente aquellos que residen en los centros de enfermería especializada y las personas sin hogar. Proteger a los trabajadores esenciales, proteger a los hospitales y el funcionamiento del sistema de salud, apoyar un subconjunto de instituciones vitales como aquellas que brindan servicios gubernamentales, escuelas, cuidado de niños y respuesta a emergencias. Salud pública, nuestros aliados y residentes continuarán utilizando todas las alternativas disponibles para responder a la pandemia y a medida que en las próximas semanas y meses haya nuevas opciones disponibles, será necesario realinear y modificar varias estrategias. Hoy queremos hablar sobre una de estas estrategias claves de mitigación, el uso de mascarilla. Como mencionamos anteriormente, el uso de mascarillas es una estrategia muy efectiva para reducir la circulación de COVID-19. Por lo tanto, a medida que avanzamos en el corto plazo, el uso de los cubrebocas seguirá siendo una parte clave de nuestra estrategia para manejar el momento en que hayamos superado la etapa del pico invernal de COVID-19. Sin embargo, algunos cambios ocurrirán pronto. Cuando el condado de Los Ángeles pase al periodo posterior a la oleada, es decir, menos de 2.500 hospitalizaciones durante 7 días consecutivos, ya no será necesario usar cubrebocas mientras se esté al aire libre en eventos o en espacios exteriores, en guarderías y escuelas de kinder a grado 12. De conformidad con las recomendaciones de los CDC, se seguirá requiriendo el uso de mascarillas al interior de los negocios, incluidos las oficinas y el interior de los lugares de trabajo, los eventos bajo techo y los entornos de alto riesgo, a menos que se den los siguientes escenarios. El condado de Los Ángeles tiene 2 semanas consecutivas en o por debajo del contagio moderado. Según lo definido por los CDC, transmisión moderada es menos de 50 casos nuevos por cada 100,000 personas en los últimos 7 días y no circulan nuevas variantes de preocupación que amenacen la eficacia de la vacuna. Donde existan regulaciones federales y estatales, también se seguirá exigiendo uso de mascarillas. Esto incluye cuando se viaja en transporte público, en centros de transporte, según lo requiera el nivel federal, en interiores para escuelas de transición a grado 12, guarderías, entornos juveniles, centros de atención médica, instituciones correccionales, refugios para personas sin hogar, lugares para el manejo de emergencias y centros de enfriamiento según lo requiera el Estado. Los sitios también deberán seguir cumpliendo con los requisitos de uso de mascarilla que se incluyen en las órdenes del oficial de salud del estado y del condado de Los Ángeles o en las comunicaciones para todas las instalaciones de atención médica. Pediremos a los empleadores que continúen brindando a los trabajadores mascarillas de alta calidad y que se ajusten bien si sus trabajos los pone en contacto cercano con otros trabajadores o el público. Hasta que la propagación sea baja, también continuaremos recomendando que mantengamos nuestras mascarillas siempre que estemos en contacto cercano con otras personas, en espacios cerrados o en lugares al aire libre que estén llenos de gente. Sabemos que durante la pandemia las empresas y organizaciones han tomado precauciones adicionales de manera voluntaria para proteger a los trabajadores, los clientes o al público. Continuarán teniendo la discreción de exigir el uso de mascarillas a los trabajadores, clientes y el público. Para terminar, agradecemos a todos por continuar durante 2 largos años cuidando a los demás y por asumir la responsabilidad de usar mascarillas y otras protecciones que nos ayudan a acercarnos a nuestra fase posterior a la oleada y a una menor transmisión del virus. Esperamos con ansiedad la transición a la fase posterior a la oleada de invierno. Muchas gracias y hasta la próxima.
Thank you so much, Monica, and thank you to everyone for attending today. If you have questions, you may send them to our media inbox at media@ph.lacounty.gov. Once again, thank you for joining us today, and we will see you next